Hi everyone, welcome to today's OBGynuggets. Today's OBGynuggets is based on a very nice concept, something that I love discussing whenever I'm talking about or I'm talking on the topic of fetal growth restriction. It's a very important concept, I'd say, and today I wish to extrapolate that concept to a few more topics that you probably didn't think could be interrelated. So the topic's name today is a little unique. The topic's name is going to be the fetal of survival and symmetry. So fetal, the story of a fetus or a tale of a fetus, and it's the story of its survival and how it has a symmetrical or asymmetrical survival. So it's a story. It is more or less like a flowchart that you need to remember, and it is something that in a way that I'm going to be teaching you all today, you all will find it very easy to remember. So, what is the basis of today's discussion? The basis of today's discussion, first of all, is between what is symmetrical versus asymmetrical fetal growth restriction. Fetal growth restriction is a newer term that we use for something that was earlier called as intrauterine fetal restriction, growth restriction. So now we call it fetal growth restriction. So what is the difference between both of them? The basic difference is, why do we call it symmetrical and asymmetrical? Basically, there are two ratios, or rather, there are two values, there are two indices of whose the ratio is what gives us the difference. So, the ratio of head circumference and abdominal circumference. If I just would want to put it slightly better, rather than making it and, I would put it as a ratio. So, this ratio, very important. Now, whenever this ratio is going to be almost equal, that is basically the head circumference and the abdominal circumference are fairly similar, that is when I would call it that the baby is in symmetry. So if this is the fetal head and if this is the fetal body, over here you can see that it is fairly similar. This abdominal circumference and over here this head circumference. Whereas if it is happening that the fetal head is like this, whereas the fetal body is not that big, it is kind of lean. So in this scenario, you can see that the head circumference and the abdominal circumference do not meet. The head circumference is quite more. So whenever the head circumference and abdominal circumferential ratio is more than 1, we call it to be asymmetrical IUGR, whereas if it is somewhere around 1, then we call it to be symmetrical. But why does this happen? Now, a few basics of embryology. In the first trimester and in the early second trimester till around 15 to 20 weeks maximum, it's more so 15 weeks, but even a little till 20 weeks, the major growth of the fetus is by increase in the number of cells. So basically, if I'm going to be talking about 1 to 40 weeks, so the first fairly half of the gestation is where the number of cells increase, whereas the latter half, that is still term, the number of cells remains constant, but there is an increase in the size of those cells. Otherwise, there will be a little bit of disturbance in the background. We have Ganpati Visarjan today in Mumbai. So, there is an increase in the size of the cells in the second or in the latter half of pregnancy, whereas there is an increase in the number of cells. So, what happens is if there is any insult that occurs, in the first half of pregnancy, how is it going to reflect? It is going to reflect in the form of decrease in the number of cells, and those decrease in the number of cells is going to be uniform throughout the body. So basically the fetus is going to be uniformly small. So when it is uniformly small, what results is symmetrical IUGR or FGR. Whereas once the number of cells are made, all the organs are formed, all the organ system, the tissues are formed, then the body learns that there are a few more important organs and there are a few less important organs. So to explain this concept of important and less important organs, so if I'm going to be talking about my organ system, I have a few more important organs in my body and there are a few less important. It doesn't make them unimportant, they're just a little lesser important than the more ones. Which are the more important organs? There is brain, there is heart, and there is adrenal. You would definitely know that brain and heart definitely very important. It helps the fetus survive. Whereas the adrenal, you would ask me, why would the adrenal be that important? Now you need to remember that adrenal secretes a few very important hormones, both the adrenal cortex as well as the adrenal medulla. There are catecholamines, which are literally your sympathetic nervous system hormones that are secreted. And apart from that, there are two even more important hormones that are secreted, and that are corticosteroids and mineralocorticoids. Now, if you remember in your NEET preparation phase, there was this one question, which is the most important hormone in your body, and the answer uniformly was aldosterone. That's a mineralocorticoid. Similarly, along with mineralocorticoid, which is secreted by the adrenal, there is something that is important for a fetus, and that is corticosteroid. Why corticosteroid? Because obviously corticosteroids help in the fetal lung maturation. The corticosteroids stimulate the fetal pneumocytes, the cells, the type 2 pneumocytes, which are the cells of the lungs, to start secreting surfactants, so that if the baby is delivered in a preterm phase, it will help it survive. So the body knows that these are my three very important organs, and whatever blood supply or whatever nutrition that I'm getting, I have to ensure that these organs are the ones that are supported first. Whereas if any organ is to be sacrificed, they would be the kidneys, which is why if there is long standing uteroplacental insufficiency, if there is a reduced blood supply to the fetus, as is what happens with severe preeclampsia and preeclampsia. So when there is going to be uteroplacental insufficiency, you also see along with it oligohydramnios. Why does that oligohydramnios occur? Because the blood supply to the kidneys has been reduced in order to be able to give whatever nutrition, whatever little blood is coming to the more important organs. Along with that, the gut, that is your intestines, your stomach and your intestines, and your liver. These are the slightly lesser important organ that the body considers that I don't need them at this point. I will restore the blood supply to them once the baby is delivered, once the circulation is restored to normalcy. But these are the organs that I can afford to not make them survive immediately. I would want to make the brain, the heart, and the adrenal glands survive a little longer than the other ones. What are the clinical implications of this one? First of all, when I talk of the brain, we have heard of something called as a brain sparing effect. So brain sparing effect is exactly what I just spoke of, wherein the brain is the one which is being spared by the body, or whatever little nutrition was coming to the body, it is being given to the brain. How does it do that? Whatever blood is coming, it has to be diverted to the brain. So what do? You reduce the radius of the blood vessels that supply the brain. Blood vessels, artery, to the brain. So all the arteries in the brain have a diameter that is increased whenever there are moments or whenever there are these occasions of uteroplacental insufficiency. So one artery that you can actually see very well by an ultrasound machine is going to be middle cerebral artery. And to know whether its radius has been increased, that is, the resistance has been reduced, there is a value that we check, that is MCA-PI. Now, PI, that is pulsatility index, is a very common, it's a very similar term to describe the resistance of the vessel. So whenever the resistance is reduced, the radius increases and the amount of blood that is coming into the brain is going to be increased. So MCA-PI is going to go down. The resistance of the middle cerebral artery goes down. This ensures that there is more blood coming to the brain to help it survive. This is what we call as the brain sparing effect. Similarly, though there are no such terms, there is going to be heart, that is cardiac sparing effect, as well as the adrenal sparing effect. Unfortunately, what happens is the kidney is not getting enough blood, so it results in oligohydramnios. The gut doesn't get enough blood. So what happens? The splanchnic circulation, that is the blood supply to the intestines, to the stomach, is impaired. So once the babies are delivered, when these babies are delivered who have absent end-diastolic flow or reversal of end-diastolic flow, these babies are often kept nil by mouth for the next couple of days by the neonatologist. They believe that until the circulation is restored back to the guts, you do not breastfeed them, because if you are going to feed them, the peristalsis is going to be poor and it can lead to perforation and even necrotizing enterocolitis if you're feeding them at that earlier stage until the blood circulation to the gut is restored. Which is why a lot of fetuses which have this fetal growth restriction often are kept NBM for a day or two after their delivery. Liver. Liver is very important to the discussion that we are having about symmetrical and asymmetrical. The entire point of discussion was to come to this organ. Now, the liver has stores of glucose called as glycogen. It also contains fats. So, whenever the blood supply to the body is reduced and hence to the liver is also reduced, the glycogen stores decrease. This leads to a decrease in the liver span. Once the liver span is reduced, there is going to be an eventual reduction in the abdominal circumference as well. Obviously, also the fact is that there is going to be a reduction in the abdominal fat as well, abdominal wall fat. But the more important aspect over here is going to be the liver span is reduced, the abdominal circumference is reduced. This reduction in abdominal circumference, whereas the blood is being still given to the brain, which keeps the head circumference normal. So basically, the head circumference now is going to be more than the abdominal circumference, and the ratio that we spoke of, that is HC by AC, is going to be more than 1. This is exactly what happens in asymmetrical fetal growth restriction. So over here, what are the causes now? Now that we have studied in asymmetrical fetal growth restriction, uteroplacental insufficiency, and a long-standing one. Why? Mostly in patients with severe preeclampsia or even just eclampsia. So this is what happens. Whereas symmetrical, when was it happening? It was happening when there was cells. जो बनने वाला phase था, उसमें the number of cells are going down. That is the early first trimester. So what are the reasons that the development of a fetus is going to be impaired in the first and early second trimester? Torch infections, torch or intrauterine infections, or if there is some genetic abnormality. So genetic या फिर chromosomal defects. Edward syndrome, Patau syndrome, something like that. So chromosomal defects. So basically something that is there since the beginning of the fetal life, that is going to cause symmetrical fetal growth restriction, because right from the time when the cells were being produced, the total number of cells are now getting reduced, which is why there is going to be a uniform decrease in the growth, which leads to symmetrical growth restriction, whereas asymmetrical is what happens in uteroplacental insufficiency. What is the significance of this? Now, first of all, there is one more concept that you need to remember, that even in a normal fetus, wherein there is nothing like infection or uteroplacental insufficiency, in a normal fetus as well, until 34 to 36 weeks, the head circumference is more than the abdominal circumference. It is between this period and beyond where the abdominal circumference increases and eventually crosses the head circumference. So basically, when a baby reaches term and has no other high risk factors, that is the time when the abdominal circumference is more than the head circumference. But at least until 34 weeks, the head circumference is at least either equal to or more than the abdominal circumference. Now, if the fetal head is bigger, like this, than the abdominal circumference, you can see that this head circumference is more than this abdominal circumference. This is what usually happens at less than 34 weeks in a normal fetus as well. Now imagine this baby is in breech presentation. Now you already know that breech presentation ka sabse important cause and the most common cause is prematurity. So it is very likely that this baby is going to be in breech presentation. Assuming that this female goes into labor for some reason, and she goes into labor and now she is delivering. Now it is a dictum, it's a thumb rule that you must have read or that you must have heard your seniors say, that avoid delivering preterm breech vaginally. We often consider it as a relative contraindication. So preterm breech is not delivered vaginally. What is the reason for this? The reason for this is because the head circumference is going to be more than the abdominal circumference. After the abdomen of the baby is delivered during breech vaginal delivery, the head is going to get entrapped. So there is going to be head entrapment, and head entrapment can lead to fetal asphyxiation and fetal death. The fetus can die if the head is entrapped. It can become a very dangerous affair because your abdomen was not big enough or it was not large enough to cause proper dilatation of the cervix. So probably the cervix was dilated to 9 centimeters maybe. But then when the head came down, you didn't have adequate time for that dilatation to progress from 9 centimeters to 10 centimeters. And the head was stuck because it was larger than the abdomen. Which is why this head entrapment can be a very deadly complication, and you avoid delivering preterm babies who are in breech presentation vaginally. You tend to avoid. For fetuses who are very small, 24, 26 weeks, they often just end up popping out. That is unfortunate. But if your baby is viable, it is having a baby weight of between 1.5 2 kg. Avoid delivering it vaginally. This is a deadly complication that can occur. This same complication, though, then you would say that at term, when the pregnancy has reached at more than 37 weeks, now the head circumference is less than abdominal circumference, which is why breech vaginal delivery can be done. At term, breech vaginal delivery can be done by people who are obviously trained in it. It's a difficult affair. There can be difficulty if you're not trained enough with it. But this is if there were no complications. What if this pregnancy had asymmetrical IUGR? Asymmetrical IUGR, assuming that the female had preeclampsia and there was fetal growth restriction and there was asymmetrical fetal growth restriction, and because of all the factors that we spoke, that the abdominal circumference is still lesser than the head circumference, in this scenario, the head circumference was still more than the abdominal circumference despite it being a term baby because of the uteroplacental insufficiency, because of asymmetrical IUGR. Now, this is that point where a breech vaginal delivery, even at term, should not be done. Why? Because of the asymmetrical IUGR that had set in, the head circumference was still more than the abdominal circumference. And that is the complete clinical implication of these abdominal and all those circumferences, all the biometry that you do in your routine obstetric ultrasound. That is the significance and the clinical implications of it. Also, today we have learnt about how and why is the adrenal gland very important, as well as along with it, we have seen as to how important is it to know what is brain sparing effect and which are the organs that are sacrificed. So that's it from today's lecture. Thank you, and I shall see you yet again in yet another episode of OBGynuggets. Until then, this is Dr. Aditya signing off. Apologies for all the background disturbances. I cannot help it today.